Hi, my name is Dr. Alan Curley, and I'm here today on behalf of the Belfast Trust to see if I can encourage and make it easier for people to stop smoking on National No Smoking Day, which is the 10th of March 2021. Now, I want to ask you a question. Do you agree that smokers are often more stubborn, more strong-minded? And there is theories that this is because that the most stubborn and strong-minded teenagers are likely to take up smoking and therefore become smokers. And I want you to think, do you think that's true, that if you are a smoker, do you think you're more strong-minded and more stubborn? Because that, having worked for 20 years helping people stop smoking, I generally believe that's true. I generally find there's a personality, there's a kind of strong, stubborn personality mindset within many of the smokers. And that's why it always amazes me that a lot of the methods out there give smokers lists of things that they need to start doing, that they should be doing better, that they have to do. Because if you understand that people are quite stubborn and strong-minded, then if you give them lists of things that they need to do, that they should be doing, and you tell them what to do, then often they won't do it. And that's why today I've chosen to talk to you about two methods that I've learned over my 20 years experience helping people stop smoking. One was developed by Right and Easy, and it's called the Right Easy method. Another one was developed by Wrong and Hard, and it's called the Wrong Hard Way to Quit Smoking. One of them gives you a list of things you have to do, tells you what to do, and therefore sometimes the stubborn, strong-minded smokers prefer the Wrong Hard method, which is things that you don't need to do, that you don't need to follow and aren't getting told what to do. And today I'll take you through both of those methods and the good and bad in both of them, if that's okay with you. It should only take us 15 minutes to go through that. Okay, and I've got some slides here. So first of all, another question is, people often ask is, why do people keep smoking? If it costs money, we've got COVID at the moment, everybody's worrying about money. So if it costs money and people are always nagging you about your health when you smoke, why do people smoke? I mean, it's a fair enough question. So I want to ask you today to think about, what do you think the 7 main reasons are that people cite for being stressed? What are currently the 7 main reasons? And I'm going to take you through what they are. First one is job pressures. Second one is worrying about money. Stressing about their health is third. Having stress around relationships or relationship issues. Number 5 is family worries. Number 6 is overload of media or negative negative information from the media. And finally, number 7 is sleep disturbances, deprivation, not getting enough sleep. And I think why it's so important today, when you think of COVID being here, that COVID's given us all of these 7 at the same time. Whereas before we might have just had to stress about one of them, we're now worrying about our jobs, therefore worrying about our finances. We've then got the health worries around COVID, the long-term health worries as well. We've maybe been cooped up in relationships, and so our relationships are, are getting quite tense. May not have seen our family, or we're worrying about our family for a while now. We're getting all this negative media information overload. We're not sure what to believe anymore. And obviously, again, changes around your working, or people not having to travel to work anymore, maybe staying up later. Might drink more alcohol, drink more coffee, tea. We're getting a lot of that when maybe our sleep has changed, our sleeping patterns changed. So you think, because COVID is here and we're getting even more stresses, then I can understand why some people think, it's not the right time to give up smoking, Alan. It's, I'm stressed. But actually what we also know from COVID is that smoking really increases the risk of being affected by COVID, having serious effects from COVID. And so, if we can beat the cigarettes, we can maybe beat some of the risk of COVID and some of the negative aspects of stress around COVID, which you see here on this slide. If you beat the cigarettes, then maybe some of the financial issues, saving some money, feeling a little bit healthier, maybe going to inspiring your family, sleeping better, because we know that nicotine is a stimulant. So, we may be able to, if you can beat the cigarettes this No Smoking Day, March the 10th, then maybe you can beat some of the risks and the negatives of COVID. And I think that's a really important message this year. Beat cigarettes and maybe you can beat some of the risk of COVID. So then what I wanted to say is, talk about two methods. As I said to you before, there's what I call the right easy method. And that's the one that you're getting told what to do and getting a list of, all that stuff, all the data stuff. Like, you get usually ex-smokers or non-smokers telling you what you should be doing, all the best things to do. Maybe stop smoking professionals are giving you all the data on, or you're 4 times more likely to quit if you use NRT or Champix, and come along for sessions with the Stop Smoking Service in Belfast Trust. You're getting told, it's 4 times easier, it's 4 times more likely, you're getting a lot of health data, getting told a lot what to do. But obviously you're a stubborn, strong-minded smoker, so you're probably going to prefer my other method, which is the wrong hard method. The wrong hard method just gives you lists of things that you don't do, that you don't need to do, that you shouldn't do. And that's the wrong hard method. You may even find that you've used some of these methods before. So I'm going to take you through the difference between them. So firstly, the wrong hard method. Now that's the one the stubborn, strong-minded people like, because it's a list of things that you don't need to do. Don't do it. And that's the wrong hard method. So the first one might be something like, keep cigarettes in the house. It's absolutely fine. You don't need to get rid of your cigarettes. The wrong hard method says keep cigarettes in the house. Keep the thing that's, gives you cravings that you're addicted to, the temptation. Keep it there. The wrong hard method says if you want to do it the wrong hard way, keep the cigarettes there in the house. The wrong hard method, if you want the wrong hard way of doing it, keep letting people smoke in your house. Don't need to change. Just keep letting people smoke in your house. Keep letting people bring out cigarettes in front of you, light them up, fill your house with smoke so that you smell it, so that you see it. And that's fine. That's the wrong hard way to do it. The wrong hard method says, look, no need to tell people you're quitting. No need to do anything. Don't tell them you're quitting. So that then, everyone doesn't know. That way then they're still offering you cigarettes, obviously. Still smoking around you. Not giving you words of support or complimenting how well you're doing, because they don't know that you're doing it. So that's the wrong hard way. Just don't tell anyone. The wrong hard way says, look, you don't need a plan for cravings. Yes, you smoke maybe 20 a day, and you know the times that you smoke every day, because that's the times you've smoked for the last 20 or 30 years every day. So you know when you're going to be craving, you know when you're going to really be uncomfortable and want a cigarette. But the wrong hard method says, look, don't plan anything. Just keep fighting those cravings, even though you know they're coming, just don't plan anything. And just put up with the fight, put up with the pain and discomfort. The wrong hard way. That's, no need to plan. The wrong hard way also says, look, don't need to change your habits. Still go out every break time and lunch time and outside whenever there's smokers outside. Just go out with them. Don't change routines. You want the wrong hard method of not being able to do anything. You're stubborn, you're strong-minded. That's brilliant. So you don't want to be told what to do. So you don't need to change. Just keep going outside with smokers, even though they're obviously smoking around you, blowing smoke in your face, probably offering you cigarettes, because remember, you've not told them you're quitting because you didn't need to do that. So they don't know you're quitting, so hence why they're still offering cigarettes and blowing cigarette smoke in your face. The wrong hard method says, look, don't change your routines about socialising. Keep going out drinking, drinking alcohol with people that smoke, and that's fine. Don't change your routines, because yes, you've got a lot of alcohol in your system, remember, they don't know you've done the wrong method of not telling them you're quitting, so they're still offering you cigarettes while you've got alcohol in your system, whether you're a bit more risk-taking with alcohol. But remember, the wrong way is about not getting told what to do, just keeping going, doing what you do. The wrong hard method also says, look, no need to sign up to the Belfast Trust Stop Smoking Support. They help staff and inpatients by giving them maybe NRT, Champix, great tips. Because, you know, the NRT and Champix, they lower the pain and discomfort of cravings. But the wrong hard way is saying, look, don't tell you what to do. Don't change anything. Just keep doing what you've done before. So just fight cravings on your own. Just fight them. Fight the pain of them on your own. Fight the withdrawals on your own. And then finally, the wrong hard method says, look, you don't need to go to support sessions. You don't need them. You know, this is about, don't tell you what to do. You're stubborn, you're strong-minded. You want to be told what to do. You don't want to be told you have to go somewhere or talk to someone and share ideas with someone. So the wrong hard method says, look, don't change that. Just sit on your own and do this all alone. Don't use NRT. Don't have all the pain of withdrawals on your own. And that is the wrong hard method. It's great for stubborn, strong-minded people because you see here it's a list of things not to do, not to change, that you shouldn't do. And obviously, the strong, stubborn smoker doesn't like getting told to change or what to do. Now, there is another method I've came across over the years, which many people have used to stop smoking. It does mean, though, that you need to open yourself to sometimes making changes, and that's what they call the right easy method, you know, by right and easy. The right easy method. Now, is very different from the wrong hard method. The right easy method says, look, attend support sessions with the Belfast Trust. We know that they can give you tips and advice and support. The right easy method says, look, get NRT and Champix because they take away the pain. They lower the pain and discomfort of cravings, withdrawal symptoms from cravings. Get as much help to lower the pain and discomfort from cravings with the right easy method. The right easy method will say to you, look, is there any way you can tell people that you're stopping smoking so that if you do want to socialise or have a drink, then at least they're not offering you and you've told them, look, please don't offer me. I'm using the right easy method, which says, you know, if I'm having a drink of alcohol, I'm trying to stay away or minimise the risk of people giving me cigarettes. The right easy method says, look, you do have to change routines and maybe not go outside for a little while anyway with people that are outside smoking. The right easy method thinks if you're outside with smokers who've blown smoke off in your cigarettes, then that makes it harder for you. That's the right hard wrong method. So they're saying do the right easy method, which is stay away from people offering you cigarettes. The right easy method says, look, if you know you had 20 cigarettes a day and when you had them, then that your body's going to crave at those times still the cigarette. Then the right easy method says, look, have a little plan. Have some medication, have some NRT, have somebody texting you, go on an app, but have some plan for those 20 times if you smoke 20 times a day. For those times, the right easy method says, look, make it easy, have a little plan. The right easy method says, look, tell people that you're trying to quit. Try and get the support of your friends, family, work colleagues. The right easy way is changing that and telling people this time. The right easy way says, look, maybe tell people that they can't smoke in your house. They can't smoke until you've done the right easy method for at least 12 weeks. Because by smoking in their house, they're making you do the wrong hard method. And the wrong harder method involves people smoking in your house. And finally, the right easy method will say, look, you need to get rid of the cigarettes in your house. Yes, the wrong hard method say keep them, make it hard, make it wrong, hard method, have them there, tempt yourself constantly. But the right easy method says, look, you do need to take on board this and change and get rid of the cigarettes. So there you see the differences between the right easy method and the wrong hard method. And again, you know, it's up to you what you choose. You know, obviously sometimes if you're stubborn or strong-minded, you want the things that you don't need to do. You want to get not told what to do. And so you've maybe followed the wrong hard method before, because you prefer that one, not being told what to do, not being told what needs to be changed in order. But maybe this time you could think about the Write Easy method. So the Write Easy method, well, what does it do? Well, first of all, what it does is it links you to the Belfast Trust Stop Smoking Service. They're there all year round, but they do actually have 2 campaigns during the year, big campaigns with the extra motivation to try and decide whether you want the Write Easy method or you want to try, without them, the Wrong Hard method. The 2 campaigns, obviously, they've got No Smoking Month, which is in March, and then they've got the 28-day challenge in October to stop smoking. So, you know, we've all heard of people doing vegan January or dry January, and this is just, you know, a kind of stop smoking version of that. You know, trying to stop smoking, trying to maybe lower risks from COVID, trying to increase your finances. 2 methods available to you. There's the Write Easy method that the Belfast Trust tend to use, and there's the kind of, you know, the smokers like sometimes the stubborn, strong-minded approach that don't tell me what to do, and that's the Wrong Hard method. Okay, the Write Easy method is shown to be particularly effective with people who've struggled before. The Write Easy method seems to make more people quit who haven't managed it using the Wrong Hard method before. And particularly tough is often when people live more in poverty, therefore the financial side of stopping smoking can be more important. We know that the Write Easy method is more likely to work for people who are maybe finding that poverty can be an issue. And we know that there's still a lot more smoking goes on in areas where people do live more in maybe deprivation, have more financial hardship. And we know that Belfast particularly has got, you know, many areas where people do live in financial hardship. And those are the people that often do smoke, would like to stop smoking, and maybe have discovered the Wrong Hard method before, or the things that you don't need to do. But actually maybe the Belfast Trust could help them with the Write Easy method that might be of more use to them. Okay, so we've got the healthcare professionals for the Belfast Trust. They're going to be there to help you. We've got smoke-free wardens like Carlo and Joe, who can then signpost you to services. You can go to the GP, you can go to the pharmacy, or you can attend, you know, the people that have particularly trained in the Write Easy method, and that's the NHS service. So that's what's there to help you if you decide that you've maybe tried the Wrong Hard method, you maybe tried it a few times and it's not worked for you, or you can go along to the Write Easy method, and you see here Paul and Darren from the NHS Belfast Trust helping out people with this new method we've found that works well, particularly for people who've been stubborn and strong-minded before and used the Wrong Hard method, but it didn't work for them. So this is who can help you on your journey. Now, not only that, the Write Easy method also says, look, there's apps that can help. There's Facebook that can help. So things like the Flow texting service that you can sign up to. It's an app. It's an app there. You can blog about your progress. You can nominate friends to help support you. You can find friends who are also doing it. You can join Facebook. So these are also extra things using like the internet, using apps that the Write Easy method definitely encourages, whereas the Wrong Hard method says, just do it on your own, sit on your own, put up with the pain of withdrawals and cravings on your own, and that's the Wrong Hard method. So not only is that sometimes tougher, even though you want to stick to your stubborn, strong-minded approach, but the Write Easy method have also got other organisations and other places and sites they work with that make it easier. So they've got, for instance, they've got Be Well, which is a health and wellbeing site for the Belfast Health and Social Care staff. Okay, it can improve general health and wellbeing, give you tips around maybe weight loss, stuff like that, because we know that sometimes if you've used the Wrong Hard method before, that sometimes again that can help put on weight. So the Write Easy method is about stopping smoking and not putting on weight, minimising that weight. We've got Take 5, and Take 5 is just kind of simple steps to keep your daily health and well-being going, like connect, be active, take notice, keep learning, give back something. Minding Your Head has got good information around mental and emotional well-being. So again, when if you've used the wrong hard method before, it doesn't say do anything with stress and anxiety, just put up with the stress and anxiety of stopping. With the right easy method, talks about let's get help, emotional help around stress and anxiety, mental health help while you're quitting, to make it a lot easier and a lot more pleasant and less painful to go through. You've got the occupational staff helpline. So again, if people are having health issues at the Belfast Trust, we've got that occupational health staff helpline. And finally, we've got Lifeline, which is a great 24/7 counselling helpline available if you were really having a particularly bad day. And the right easy method would definitely tell you to use that. Whereas the wrong hard method is all about, no, you're doing this on your own. You started smoking on your own. You can stop smoking on your own. Just put up with the pain and discomfort and do it on your own. And that's the wrong hard method that some stubborn, strong-minded smokers have used in the past. So finally, I just want to finish this session by giving you a 1-minute technique that I've learned that helped me when I stopped smoking. It's based around mindfulness. Mindfulness is very just simple breathing exercises, lasts about 1 minute, maybe 2 minutes at the max. And I call this smoking mindfulness or stop smoking mindfulness, because I try to mimic what the cigarette used to give me when it sometimes helped me relax when I was in a stressed moment. But I've tried to do that technique without them pumping nicotine and toxic fumes into my body, which cost me money and obviously maybe made me more at risk of COVID symptoms. So in this one, I want you to imagine if you're in one of those moments that you're really a little bit anxious, you're craving the cigarette. Imagine doing what you would do if you had the cigarette. You'd maybe go out into the garden, go outside. So imagine you're out in the garden, you're looking onto some beautiful flowers. And all you're going to do is, when you feel you're outside, imagine you're outside in the garden, just closing your eyes and smelling those flowers. But because it's a mindfulness technique, then mindfulness is about trying to then focus on what you have good in your life at the moment. What's positive? What are you grateful for? Is there anything in your life that you love more than cigarettes, that you love more than smoking at the moment? And this is particularly useful mindfulness because of COVID, because COVID is getting us all worrying about the present, worrying about the future. Our minds are all over the place. And mindfulness is about saying, just let's stop worrying about the past or the future. Let's just take a moment to get back into our present life, and just focus on one thing that is good about our lives at the moment, about us or our lives. One thing we are grateful for that is here, we've got, or one thing we love more than a cigarette or smoking. And so when you breathe out, so you're outside, you're smelling the flowers, but when you breathe out, imagine you're blowing out the candles on your cake. And the only reason I use that image here is that it's like it's your birthday, because you're trying to think of gifts that you've got today, presents that you've got in this special present day. And then finally, I want to add you a wee technique into the breathing. So you're going to imagine you're outside, smelling the flowers, smelling a lovely aroma, and then when you breathe out, blowing out the candles, because this is a special day. You've got gifts or presents in this present day. Finally, the last one is anchoring. Anchoring just means you do something physical, so that when you're thinking of the one thing, just one thing that you're grateful for, or you're really happy that you've got in your life today, or something that you love more today than cigarettes or smoking. When you do that, when you breathe out, you imagine that, and you just press your thumb and 4 fingers together. So as you take a deep breath in, imagine you're outside, just smelling the flowers, smelling that aroma, you press your thumb, and when you press that, try and bring in to your focus that one thing you're grateful for, you're happy about, that you love more than cigarettes or smoke. And then when you blow out the candles, imagining it's your birthday, you're getting a special gift that you've got today in your life, thing you're grateful for. Then you press the other thumb and 4 fingers. So as you smell the aroma, bring in the focus, that one thing you're grateful for. And then as you blow out the candles, press the other thumb and 4 finger, and bringing back into that focus, that one thing you love or are grateful for. And all you're doing then is taking 10 breaths in. So pressing that, and I'm focused on the thing I'm really grateful for, and I blow out the candles, and I press that as well. And after 10 breaths in and out, doing your 10 pressings and bringing into focus the one thing you're grateful for, or that you love more than smoking or cigarettes. Then after those 10 breaths, you should find within a minute or two, if you practice it, you're relaxed, the craving is gone, or very much lowered, and you're ready to move on without a cigarette. And just finally now, so if you really do want to try the right easy method, if you're fed up of the wrong hard method, the one that doesn't tell you what to do, that doesn't give you a list of things you should change or do, if you're stubborn, strong-minded, use that and just found eventually, right, okay, I didn't need to do anything, I wasn't told to do anything, but it didn't work for me, then why not give the right easy method a go this time? In order to get into the Belfast Trust Service, all you need to do, and they'll give you the 12 weeks NRT, they'll get you Champix if you want, things to take away the pain or ease the pain and discomfort of cravings. They can get this on your behalf, this medication, to make it easier. You just have to go to the Trust Hub intranet, click IT systems, all IT systems, scroll down to referral forms and systems, and click smoking cessation referral. Or maybe even easier, an even easier method for getting into the easy method is phone 0289 504 6714, or just email stopsmoking@belfasttrust.hscni.net. So thanks for listening today. I hope you've learned about the two different methods that I've certainly used in my life to stop smoking. The wrong hard method, you know, because I didn't want people to tell me what to do. I was stubborn, I was strong-minded. Don't tell me what to do. Don't tell me all the data and what I should be doing. I used that method, but you know that didn't quite work for me. And then I discovered, along with the Belfast Trust, using the support of Belfast Trust, the right easy method. Yes, sometimes I had to change routines, and sometimes I had to be told what things to bring into my life, but it took away the pain and discomfort. It gave me the results, and it maybe helped lower some of my risk of the symptoms of COVID. So thank you very much.